One of the biggest problems that a lot of the Asian American communities have is this model minority stereotype. And a lot of times our mental health or addiction issues are not highlighted because of the model minority stereotype. And so my talk will be focusing on deconstructing this model minority versus a problem gambler in the Asian community. So teasing apart that and also talking about how so important it is to disaggregate the data. And because right now, when you lump all Asian groups together, it is really hard to identify the prevalence of problem gambling. Asians in their countries have the same gambling rate as other ethnic groups. But the Asians who have immigrated from their countries, and like Asians in Australia, Asians in, the US, Asian in other countries, have a higher rate than the mainstream population. And so there's a lot of different factors that leads to this.
What are some of the misnomers about our community? Are we truly hesitant and hard to engage with? Or do we have a valid mistrust and a valid fear of what we might experience if we actually reach out and get help, right?
It's all about asking the right questions, engaging, learning the Latino cultural values and how all of those interact and come up in treatment when you are offering those clinical services, or even in the paraprofessional world.
A lot of, treatment kind of see the clients in absence of the context of their family, of their environment. It's not just them, but then family is huge. And then their community is huge. When did they come to America? And then the social, economic, or even the racial climate has a huge impact on our clients.